Welcome back. Earlier today, we spoke to Kelly Maloney about her facial reconstruction surgery that left her moments from death, and we asked you to get in touch if you had or are considering surgery abroad. Well, we're joined now by plastic surgeon Angelica Kavouni and travel law expert Paul McClory to take your calls. Thank you both for coming in, and let's go straight to Amanda. Hello, Amanda.
Hi.
Hi, you had a dreadful experience, didn't you?
Yes, I did. It was horrific. It was awful.
What happened? Talk us through it, yeah.
Yeah, my friend decided to go over to Belgium for surgery, and hers went brilliantly well. So that kind of swayed me to go to the same clinic. I wanted to have a full tummy tuck done. So I went to the same surgery for the same surgeon, and literally from day one it just all went wrong. My stomach, as soon as I had the surgery, wouldn't heal properly. I was flown home the day after the surgery. I was told I could go home, and from then on it was horrendous.
Well, you say that you say your stomach ripped over, you got gangrene, trying to contact the surgeon was nearly impossible.
Yes.
Thankfully the NHS centre sort of jumped in, and the nurses told you would have died if you hadn't had any help. So if you get a situation like that where someone has a good experience and then with the same place you have a bad experience, what do you do?
That's it. You see, I was kind of swayed because her surgery, my friend's surgery, went so well.
Yes, absolutely. We'll hear from the experts.
From a legal perspective, I'm very sorry to hear this, because it sounds like this surgeon in Belgium now can't be traced, which presents a very difficult legal problem. What you need to do, first and foremost, is obviously go to a good expert who can provide you with the medical care, but from a legal perspective, it is very, very difficult. There are international tracing agents which could trace this surgeon and then consider what options may be available to you.
Amanda actually said her first words were, on the sheet of paper I've got here, don't do it. Is it really that risky to go overseas?
Well, obviously she did follow one of the rules that we suggest that the patients do, i.e. take a recommendation from a friend or a family member. So, but unfortunately complications do happen even with the best hands, and aftercare is one of the big issues when you go abroad. Some doctors who have trained in the UK and then go to work abroad have sometimes partnerships with colleagues based in the UK, especially for this reason. So I think if you decide to go abroad, it will be very important to make sure that there is someone that you can turn to if things go wrong.
Well, it's interesting because we've got Tyrone on the phone now, and 2 years ago Tyrone went abroad to Japan to get a bum enlargement, paid £15,000. The surgery was absolutely fine. Only when on the return started to have trouble going to the loo, was rushed to Leicester Royal Infirmary only to find out that you'd been stapled together inside.
Yes, that is correct.
So,
I did have some consultations via Skype with the surgeon about a month before I flew out, and everything seemed perfectly fine. Yes.
So let me ask you this question, Tyrone. I mean, and once again, I mean, I think you're going through gender reassignment, and you back here had to sort of sort you out. If you were going to do it all again, is there anything that you would do differently?
Never ever again. No, I will stay in this country and have it done the proper way, because we tried to trace them down over in Japan, but nothing can be done. They're lost now. We can't find anyone, so I'll never do it ever again. And
so, and I have to ask you once again, you know, is it worth going overseas? Is it worth taking that risk? Is everything you can get over there available over here?
Absolutely, and even very complex procedures are better done in the UK, because quite often we have teams of surgeons that work together. In particular, gender reassignment surgery is extremely complex surgery. I find it amazing that people will travel abroad to have this type of work done.
It's the cost, isn't it? I think it's cheaper abroad, so that drives people abroad.
I know, but
it's in the end it's not worth it.
Very expensive in the end.
Yeah.
And the difficulty we see, particularly with Tyrone's case, unfortunately, it's a similar point as that Amanda made before. When these surgeons restrictions disappear, what can you do? And the answer is the law can do very little. It's more of a problem if it's outside of Europe as well, because bringing a legal case within the UK is difficult enough. But if it happens outside of Europe, that problem is compounded, and unfortunately legal claims often aren't viable, so there is no right of redress that works.
So, and that really, literally is it. If it happens to you, the chances are tough.
Yeah.
Almost.
I mean,
Almost.
That's harsh.
It is, but unfortunately, a claim such as Tyrone's, it would not be viable to be brought in England. The cost of bringing that type of legal action, legal aid is not available anymore, so Tyrone may have to fund that privately himself, which it just wouldn't be worthwhile in terms of the amount of potential compensation.
Final piece of advice. Anybody watching here who's thinking about it? We've got people who are thinking, a partner needs dental work. I'm hearing Turkey is good. What do you say to them?
I think it's very important to research the doctor and the clinic. It is important to find out whether there is someone that they cooperate with in the United Kingdom, but at the end of the day it might be a lot more expensive if you go abroad.
Thank you.
And two practical tips as well, always look at insurance, always look at insurance that's good for you, and consider booking by credit card. There's extra protection.
Great,
Thank you both very much indeed. We'll see you right after the break.